Welcome to the Memorizing Pharmacology podcast, bringing you free resources to relax, recall, and succeed in pharmacology. You can find the link to this free nursing pharmacology book and others at memorizingpharm.com. A little under the weather, and so ironic that this is ID as our topic, infectious disease. Just a little quick note that we've already recorded the first edition. We didn't know there was a second edition of this book. So we're going to go ahead and release the recording of the first edition for the antimicrobial section. And because you can still go to the second book and do the activities, when we looked at the actual differences in the content, there was not a ton of difference in content, but there was some difference in activities and things like that. So starting with Unit 4, we'll be reading out of the second edition book of the Open Educational Resource, Nursing Pharmacology. But here's the narration with video of the 3.1 Antimicrobials Introduction of the first edition.
3.1 Antimicrobials Introduction. The learning objectives in this chapter are identify the classifications and actions of antimicrobial medications, give examples of when, how, and to whom antimicrobial drugs may be administered, identify the side effects and special considerations associated with antimicrobial therapy, include considerations and implications of using antimicrobial medications across the lifespan, include evidence-based concepts when using the nursing process, and identify and interpret related laboratory tests. Have you ever been prescribed an antibiotic for an infection and asked, why do I have to finish taking all these pills when I already feel better? Or perhaps you wondered why the healthcare provider chose a certain medication over another, or why the pharmacist told you to avoid certain foods when taking a certain antibiotic. You may have had these questions in your own healthcare experiences. It is important to remember that if you have these questions, many of your patients will as well. Learning about the various types of antimicrobials and how they work will help you provide better health education to your patients. Did you know that the use of antimicrobial agents date back to ancient times? Although the discovery of antimicrobials and their subsequent widespread use is commonly associated with modern medicine, there is evidence that humans have been exposed to antimicrobial compounds for millennia. Chemical analyses of the skeletal remains of people from between 350 and 550 AD of people living near the Nile River have shown residue of the antimicrobial agent tetracycline in high enough quantities to suggest the purposeful fermentation of tetracycline producing streptomyces during the beer making process. The resulting beer, which was thick and gruel-like, was used to treat a variety of ailments in both adults and children, including gum disease and wounds. Additionally, the antimicrobial properties of plants and honey have been recognized by various cultures around the world, including Indian and Chinese herbalists who have long used plants for a wide variety of medical purposes. Healers of many cultures understood the antimicrobial properties of fungi, and their use of moldy bread or other mold-containing products to treat wounds have been well documented for centuries.
Thanks for listening to the Memorizing Pharmacology podcast. You can sign up for the email list at memorizingpharm.com to get your pharmacology suffixes cheat sheet, find drug pronunciations, and other free resources to relax, recall, and succeed in pharmacology class. Thanks again for listening. Music was by Policy.